Hey, good afternoon. This is Dr. Joseph Adeboyega, Dr. Joe in Winston-Salem, North Carolina. This short video is introductory video on the psychopathology of mental health. We are going to spend about a few minutes to just discuss in an introductory fashion the whole PowerPoint presentation. You are expected to watch the video as an introduction, and then study the PowerPoint presentation, do the quiz in the PowerPoint presentation, and then submit those for grading so that you can get a 3 to 4 hour credit CEU for the training. So far, so good. Let me get started. Um, I am the presenter in Winston-Salem, North Carolina. Um, the second slide talks about who will benefit from this training. They are mostly mental health professionals, inclusive of counselors, social workers, therapists, and psychologists. And then we go on to study the definition of psychopathology. Psychopathology deals with the study of mental health, how it runs, how it works, and how people can be helped. It's a pathology. First of all, the psycho deals with the mental aspect of it. The path talks about the route or the way it occurs. The pathology is the study of the essential nature of the disease and especially of the structural and functional changes produced by the disease. The disease will mean brain disorder. Now uh, we'll go on to the next slide, which talks about psychopathology is a scientific exploration of abnormal mental states. This has for centuries provided a gestalt for psychiatric disorders and guided both scientific and clinical progress in psychiatry. Psychopathology refers to the study of mental illness or mental distress. Um, Gestalt theory says that the whole of anything is greater than its parts when taken in isolation. This means that the attributes of the whole cannot be deducted from the one part when taken in isolation. Now, what other words are used for psychopathology of mental health? It is mental illness, derangement, insanity, madness, lunacy, psychosis, mania, psychopathy, uh, craziness, neurosis, etc. Now, who are the professionals involved in psychopathology of mental health? They are essentially all the clinicians involved in treating mental health disorders, namely clinical psychologists, counselors, criminologists, marriage and family counselors, nurse practitioners, psychiatric nurses, psychiatrists, social workers, and so on. Next, we'll talk about it is important that psychiatrists are to know that psychiatrists are medical doctors who deal primarily with mental disorders. They have a medical degree with additional mental health training. They diagnose and treat people with mental illness. That is for psychiatrists. Psychopathology is all about exploring problems relative to mental health. It is about how to understand them, how to classify them, and how to fix them. As a result, the topic of psychopathology extends from research to treatment and covers every step in between. Better to understand why a mental disorder develops as to make it easier to find effective treatments. So, the modality of treatment is the next another slide. Counseling Counseling is a collaborative effort between in fact, we talk about the distinction between counseling and therapy. Counseling itself is a collaborative effort between the counselor and the client. Mental health professionals help clients identify goals, potential solutions to problems which cause emotional trauma, seek to improve communication and coping skills, strengthen self-esteem, and promote behavior change and optimal mental health. That is what counseling and therapy do. Um, what is the primary role of the therapist, which is the counselor? The primary role is to assist clients in reaching their optimal level of psychosocial functioning through resolving negative patterns, prevention, rehabilitation, and improving quality of life, which is improved mental health. Now, then we go on to one aspect of the kind of professional that deal with psychopathology of mental health. What is a CRC? CRC is Certified Rehabilitation Counselor. They are rehabilitation counselors that work with clients with disabilities and or chronic illnesses, including those with psychiatric conditions, in settings such as state vocational rehabilitation agencies, hospitals, and so on. These are the different classes of mental health professionals. The CRC is the first one we're dealing with. The next one is addiction counselor. What is addiction counseling? Addiction counseling is a recently acknowledged master's level counseling specialty. It involves working in the substance abuse/addiction field and provides addiction prevention, treatment, recovery support, and education. Who are addiction counselors? They are master level counselors. They are credentialed as either LCAS or MAC, CADC2 nationally or statewide. There are other credentials too under the same category. What are the signs of mental health psychopathology? They are such as changes in eating habits, changes in mood, excessive worry, anxiety, or fear, feelings of distress, inability to concentrate, irritability, or anger. Now, the other signs too continued is low energy or feelings of fatigue, sleep disruptions, thought of self-harm or suicide, trouble coping with daily life, withdrawal from activities and friends. The method of diagnosing mental health disorder is the DSM. DSM. The DSM is Diagnostic Statistical Manual of the American Psychiatric Association, APA. DSM-5 was written in 2013. This is the latest one. It is the current edition and includes identifiable criteria that mental health professionals use to arrive at a specific diagnosis. There is also the ICD. The ICD is International Classification of Diseases. Method of diagnosing mental health disorder is this DSM and of the APA and the ICDC. ICD, which is the international one. The DCSM is standard for classification of mental disorders among American mental health professionals and is generally used for treatment planning and insurance purposes. ICD, on the other hand, the International Classification of Diseases, ICD is a system similar to the DSM. Current version is the 11th version. The ICD was developed over a century ago and was taken over by the World Health Organization when it was founded in 1948. DSM-5 is, so how does this ICD-11 differ from DSM-5? DSM-5 is national to USA, while the ICD is issued by a global agency, World Health Organization. DSM-5 is strictly for mental health diseases, whereas ICD includes both mental health and medical conditions. DSM-5 is the standard for classification among American mental health professionals. It is generally used for treatment planning and insurance purposes. User has to buy the DSM-5 book, while the ICD is generally available for free. DSM-5 has to be purchased. There is also the RDoc. The RDoc is a research framework initiated by the National Institute of Mental Health, NIMH, based in translational research from areas such as neuroscience, genomics, and experimental psychology. RDoc is involved in describing the signs and symptoms of psychopathology rather than grouping them into disorders, and has been historically done with the DSM and ICD. The distinction between normal versus psychopathological behavior comes down to how issues are affecting you or the people around you. The diagnosis or description of mental condition could be described as follows: defiance, distress, dysfunction, and danger. Now, for danger, defiance are thoughts, emotions, or behavior that deviate from what is common or at all to what is deemed acceptable in the society. In the case of depression, you might report thoughts of guilt or worthlessness that are not common among other people. Distress is defined as negative feelings either felt within a person or that result in discomfort in others around that person. In the case of depression, you might report extreme feelings of distress over sadness or guilt. Dysfunction with this symptom, professionals are looking for inability to achieve daily functions like going to work. In the case of depression, you might report that you can't get out of bed in the morning or that daily tasks take you much longer than they should. Danger. This term refers to behavior that might put you or someone else at some types of detrimental risk. In the case of depression, this could include reporting that you are having thoughts of suicide or harming yourself. The distinction between normal versus psychopathological behavior comes down to how issues are affecting you or the people around you. Often it is not until things come to a crisis point that a diagnosis is made when someone comes in contact with a medical or mental health professional. What are the causes of psychopathology? Uh, the causes are biological factors, including genes or brain chemistry, chronic medical conditions, family members with mental illness, feelings of isolation. What are the causes? Lack of social support, substance or alcohol use disorder, traumatic or stressful experiences. And then we have come a long way since the earliest beginnings of trying to make sense of mental illness. Although individuals with mental health issues still face stigma and a lack of understanding, things were very different in the past. Concept of mental disorder in the past. Hippocrates, the 4th century BC Greek physician, rejected the notion of evil spirits and argued instead that mental illness was a disease of the brain relating to imbalances of bodily humors or chemicals in the body fluids. Around the same time, the philosopher Plato argued that mental distress involved issues of virtue, morality, and the soul. People who lived in the 16th century with a mental health problem risk not being treated very well. Uh, Mental illness was often viewed by a religious or superstitious point of view. Accordingly, it was assumed that people demonstrating strange behavior must have been overtaken by evil spirits or demons. Concept of uh, mental disorders. Later in the 19th century, interest surged in the role of childhood and trauma in the development of mental illness. Following on the heels of this era, Sigmund Freud introduced talk therapy to deal with these unresolved childhood issues. Here are the quizzes. The quizzes are about 13, actually 14 16 in number. And once you complete the quizzes, then you can get the 3 to 4 credit hours. Thank you very much for watching. Feel free to email me for a copy of the PowerPoint presentation.